We have had Ebola crises in the past. We've seen this situation in the Philippines, in Congo, Uganda, but never have we seen it on the scale, with the reach that this current epidemic has in Guinea and Liberia and in Sierra Leone. There are 14,000 cases on record. There are 5,000 people who have died. There are thousands of children at this time who have been orphaned. And these numbers are very shocking, and the numbers are growing. What has worked in the past to block Ebola, obviously, is breaking the chain of transmission. But without us doing that, Ebola will continue to spill across borders, and economies will be devastated in Africa. Governments will fail. Tens of thousands will die. And that is no exaggeration. And that means that this isn't just a problem for West Africa, but a problem with far-reaching health and economic and security consequences for the globe. And I'd like to recognize Chairman Smith for convening an emergency hearing we held together during the African Leaders Summit in August, despite concerns by the administration that it would be a distraction. President Sirleaf, Ellen Johnson Sirleaf of Liberia, called to thank the committee for standing by Liberia. Chairman Smith, who has been working closely with our ranking member, Karen Bass, on that subcommittee, will convene a hearing next week with the key non-governmental organizations engaged in the response. Unfortunately, we are paying the price of early failures. The World Health Organization, which is the UN agency charged with leading the response to health emergencies, downplayed the crisis. Inept country office directors ignored warnings by Doctors Without Borders. As a matter of fact, they wrote a rebuttal to the concern raised by Doctors Without Borders. They refused assistance early on from the Centers for Disease Control and from USAID, and they blocked entry for teams of experts. By the time that the World Health Organization finally sounded the alarm on August 8th, the outbreak was out of control. Of course, the United States has generously provided support to the WHO. This was a failure of policy, not resources. Our director of the Centers for Disease Control serves on WHO's executive board, and we need to be pushing to reform the organization. Improving accountability would be a very good place to start, and having country directors that are not cronies, but in fact are ready to stand up and deal with the problem instead of trying to deny it is a very good place to start. In contrast to the WHO's failures, USAID immediately activated a disaster assistance response team. It immediately got people to the region. And today, USAID, supported by the Department of Defense and CDC, is leading a robust disaster response. As we will hear from Administrator Shaw, who contacted myself and Mr. Engel after his trip to each of these countries, treatment units are being opened, lab capacity is being expanded, medical workers are being trained, and burial teams are working to reduce transmission. Reports from Liberia indicate that this is having an impact. None of this could have been done without the commitment and sacrifice of the brave men and women, of the doctors and nurses and civilians, and both civilian and uniformed personnel in all of this, who have answered the call for help. But we cannot afford to let up, and we cannot afford to do this alone. Containment will fail in the absence of a robust international effort. Other donors and the UN need to step up, just as we're stepping up. And they need to step up, particularly in Guinea. The WHO needs to be part of the solution rather than a hindrance. And our embassies need to put in place additional prudent containment measures that will add a layer of protection while not impeding the Ebola response, including a temporary suspension of visas for non-U.S. nationals coming from the region. We look forward to learning more about the international efforts to help contain the epidemic at its source and evaluating the administration's request for additional resources in this fight to address one of the most pressing health emergencies of our time. And I now turn to our ranking member, Mr. Eliot Engel of New York, for any opening remarks he might have.